Turning to Darfur, yesterday evening, a patrol of the African Union, United Nations peacekeeping operation in Darfur, returning to its base in El Janina, West Darfur, was attacked by unknown armed men who fired at the vehicle with small arms. 4 peacekeepers were shot and wounded in the attack, one of them seriously. The injured personnel were evacuated by helicopter for medical treatment to the mission's hospital in El Fashir, North Darfur, where their conditions were listed as stable and not life-threatening. UNAMID is investigating the incident. UNAMID strongly condemns these acts of violence against its peacekeepers who are in Darfur to help bring peace and stability to the region and for the benefit of the population. Violence against UNAMID personnel and banditry have increased over the past 6 weeks in West Darfur. The number of incidents so far in 2009 have exceeded those for the entirety of 2008. Also yesterday in El Fashir in North Darfur, again, a UNAMID vehicle was carjacked by 3 unknown gunmen. No injuries were incurred, and the incident was reported to the Sudanese government police. This morning, a UNAMID military observer en route from his residence to the mission team site in El Dayan, approximately 160 kilometers southeast of Nyala, was shot at by 2 armed personnel. 1 bullet entered the rear of the vehicle and hit the front window. The driver lost control of the vehicle and hit a pole, but no serious injuries were reported. Meanwhile, during the past 24 hours, UNAMID continues its work. It conducted 31 confidence-building patrols, 7 escort patrols, and 9 night patrols covering 41 villages and camps housing internally displaced persons. Similarly, UNAMID police conducted a total of 96 patrols in and around villages and IDP camps. And on the humanitarian front, the United Nations remains highly concerned over the safety of national and international staff in light of repeated reports of intimidation and harassment. Despite assurances given by the Sudanese government that harassment and seizure of assets would stop, such reports continued to be received daily, according to the Office for the Coordination of Humanitarian Affairs. Crucial assets have been confiscated from these humanitarian organizations, including computers, vehicles, and communications equipment, as well as essential data. But OCHA reports that there have been no further revocations of permission to work. But as the rainy season is now coming up, and as the country will soon be split in 2 due to the rains, it is urgent and essential to preposition food and non-food assistance in the warehouses as rapidly as possible, OCHA says. Some 1.5 million people are in risk in terms of health. An estimated 1.2 million people risk having no more access to potable water and education and hygiene programs in the weeks to come, according to UNICEF. Even though UNICEF is currently working 24 hours a day with its partners and they're in the various ministries, UNICEF says it could not overcome the lack created by the absence of the various non-governmental organizations. The World Food Programme, meanwhile, says that 4 of the expelled non-governmental organizations were crucial partners. They were providing 35% of their food distribution capacity in Darfur. They had been distributing food to 1.1 million people, plus 5,500 malnourished children and mothers receiving supplementary feeding in Darfur. WFP and other humanitarian agencies do not have the capacity to fill such a gap, they say. But WFP says it is doing everything it could to respond to the urgent needs in the areas where the non-governmental organizations had been forced to leave. And they were planning a one-off distribution of enough food for 2 months through local food relief committees. And the World Health Organization says that more than 1.5 million persons would no longer have access to primary health care with the absence of the non-governmental organizations. Their absence would be highly felt on several programs. Immunizations would be disrupted, and the communicable disease early warning alert and response system would be interrupted. This situation would increase the risk of disease outbreaks and higher rates of mortality and morbidity. Further, an outbreak of meningitis had been reported in the Kalma camp, which currently houses some 89,000 people. The United Nations and the Sudanese government have agreed, meanwhile, that 3 joint UN-Sudanese government teams composed of experts from both sides would visit Darfur to conduct an assessment of critical short-term needs in 4 sectors: food, nutrition, water, and emergency shelter. And there's more on this in the briefing notes from the humanitarian agencies upstairs.